Grace Rothwell, good morning.
Morning.
How are you?
Good. The sun is shining and people are working hard here, and I suppose we're stable.
What sort of procedures has one put in place from a crisis management point of view? Like your own day, is there meetings every day to try and make sure everything is set in place? Or what have you done in the last 5 to 6 weeks that's different, for example?
Okay, so we're kind of 7-8 weeks now, Damien, actually on the go. So we have a crisis management team here in the hospital that meets at 7 a.m. daily, and the same team meets again at 3:30 in the daytime, and then at 11:30 every day we have a wider stakeholder meeting. So at that we look at the activity, I suppose, in terms of ED and any surgical cases, as well as the COVID activity. We look at the numbers of positives, the numbers of suspect, any issues arising in that regard. Obviously we talk about PPE and the levels available and changes that come, maybe a different product, requirement for training, requirement for intervention from infection prevention and control. We also have got a lot of works done here over that 8-week period, and I suppose with the new build there has certainly been some teething problems. So again, all those kind of things are talked about, very practical, operational, and I suppose day on day then those things are followed up. Plus of course there's the rest of the hospital that still continues. So in the case of ED now we've separated ED into a COVID ED and a non-COVID ED, and that's I suppose something that's very important at the moment, to try and get the message out to people in the community that the ED is in effect open for business, and people should feel assured that it is a safe place to come. We have 2 separate streams now. You'll be assessed at the very entrance to ED by a senior medic, and you'll either be on a COVID pathway or a non-COVID pathway. And I suppose we are keen that people wouldn't remain at home if they're unwell. So yesterday was Wednesday the 22nd, and we had 111 attendances through ED. Now the norm really for a Tuesday, Wednesday would probably be somewhere around the 200. So there are people that are certainly not presenting to ED. So that is a concern.
When you say it's a concern, do you think they're at home maybe possibly suffering from some ailment or some condition that for some reason they just don't think it's right to go to hospital that minute? Like the message that you'd want to get out to them?
I suppose it's a bit of both probably. I'm sure there are some people that probably feel we're busy enough. You know, though there's a cohort of people that are probably saying they're working very hard there and they're busy enough without me going. There's probably another cohort of people that are genuinely afraid to go. So I suppose the message I would say again is that, you know, we are here to look after patients. Our ED is available 24/7 and, you know, very safe in terms of COVID. Nobody should have any fear of contracting COVID. We've had no outbreak in this hospital. We've had no patient-to-patient contact, staff to staff, staff to patient contact. Our COVID pathway has worked very well, and that's largely attributable, I suppose, to 2 things. One, the physical infrastructure, and by that I mean the new Dunmore wing. And the second thing obviously is our staff, and our staff, huge teamwork here displayed by every member of staff in all departments since really early March. Like this is 7-8 weeks now. Yeah.
What have you done regarding redeployment? Have you had to put in place systems to redeploy people?
Well, again, I suppose because we opened new areas, we also closed other areas. The list is so long now, I couldn't be specific, but anyone that was asked to move, like we've also moved our haematology oncology inpatients out to UPMC. So again, huge movement of staff. And again, I certainly never heard anyone, you know, I suppose, be disgruntled about that. People accepted it as this was our plan, this is what we were doing to protect our patients, but also to protect our staff. So massive redeployment, yes.
How are you fixed with PPE? How has it been? Have you got enough PPE? Has there been times where you'd be saying we need more?
Okay, so PPE is one of those things that we talk about at the crisis management team. So first thing to say is we've never had an instance where we didn't have PPE to issue to staff. So that's a positive. Yes, there are challenges, and there are challenges on an ongoing basis.
And is it the right PPE?
Well, PPE, the question really isn't the right PPE. The question is probably, is it the same PPE you had yesterday and the same PPE you're familiar with? And sometimes it's not. So there's multiples of different types and different brands. So I suppose we understand the reasoning for it. And yes, that does cause a little bit of concern and a little bit of angst. But again, we've a buddy system going here. So people, when they're actually putting on their PPE, or donning, as we call it, donning PPE, and doffing, which would be taken off the PPE, would be supported by a colleague to make sure that you're doing it right. But we talk about it every day. We know what stocks we have. Indeed, some local businesses have been very helpful to us. I myself contacted Bosch and Lom and others to say, you know, do you have supplies? And they were very good. They put us in contact with people, or they gave us people, and we got several donations from science labs and schools. And you can see the office here is full of different stuff. Well, it's not full because we've used a lot of it. But so to answer the question, we've never had a day that we didn't have PPE. Yes, there are shortages. Yes, it needs ongoing management. And only yesterday now we got updated guidance from the Health Protection Surveillance Centre, basically saying surgical face masks now to be worn by healthcare workers who are more than 15 minutes in close proximity, i.e. less than 2 metres, with either a healthcare worker or a patient. So that will create its own concerns, and I know some staff members naturally so will immediately be concerned and feel we all should wear surgical face masks. But the guidance is quite clear, and it is healthcare worker in close proximity with either a healthcare worker or a patient for more than 15 minutes, and the close proximity is less than the 2 metres. So really, first and foremost, the measures that remain are hand hygiene and social distancing. So that'll be a challenge in itself over the coming days.
And the fact that those guidelines have been reissued or changed, people might say, why weren't we told that 4 or 5 weeks ago?
Well, personally, I think that there's different parts of the country. So Dublin to date has been very challenged, and I mean other hospitals also have had outbreaks in their actual hospitals. So we in Waterford have done very well. We haven't had an outbreak. We haven't had anything like the numbers that the Dublin hospitals would have seen, or the numbers of confirmed staff, like positive staff, that other hospitals would have seen. So my own personal view is that whilst this was introduced in Dublin some time ago, you know, whether it's the right or the wrong thing to do, not for me to say, but I certainly don't think that it was a requirement, and I'm cautious about it now. I understand, I suppose, as we seek maybe to move out of the more rigid measures in terms of social distancing and the travel and those kind of things, that perhaps this is something that will become part of the way we all live our lives. But I suppose I would feel a little bit concerned that staff maybe would think, well, how are we getting them now and why didn't we have it? So we always follow the microbiology advice, and we have a very strong team of microbiologists here in the hospital, and anything that comes from Health Protection Surveillance Centre, you know, we do as we are guided to do so, and if that's what we have to do now, that's what we'll do.
How many staff have tested positive for COVID?
I'm not so sure that that's in the public domain, but in this hospital it is less than 15, and none of those were acquired in the hospital.
And what happens in that situation then? I presume the contract tracing goes in place. Any staff that would be in contact with that person then goes home and isolates for 2 weeks, and all the procedures are put in place, which is a testament to the management of how you've managed the situation, that there hasn't been any further, as you say, outbreaks in the hospital, any outbreaks at all.
Yeah, so again, I suppose part of the crisis management team. So there's 3 of us. There's myself, there's the Director of Nursing, and there's the Deputy Operations Manager. So between us we've a rota. So we're the leads on that would link with whatever consultant microbiologist is on every day in terms of results, both patients and staff. So yes, contact tracing then is done if and when there are positives. And in the context of a staff member, that's basically linking with that staff member, talking them through and documenting their movements for the 48 hours prior to the day that they're actually confirmed as positive. So there can be obviously, you know, family contacts as well as the work contact situation. And then you have to examine each and every rota. So, you know, if for argument's sake there was somebody that was in a number of areas in the hospital. You actually have to walk the person through all of those areas, establish, the duration of the time spent in that ward, the proximity they were to different staff members and indeed our patients. But I'm saying, our staff, certainly people have been very good. The measures, people are taking them seriously now. It takes constant reinforcement, and that's fine too, because people do get a little bit complacent, and I never see it as a negative. I'm a firm believer that nobody gets up any day to do harm. So I think sometimes we just need little reminders. But to date, staff have been very good, and we're doing a piece now for the next few days around trying to maintain that resilience here and trying to maintain that focus among staff.
Finally, how are you?
Yeah, I'm good.
How are you managing? How's it been? To manage such a major group of people with so many different disciplines in a completely strange crisis environment.
Yeah, well, I suppose unprecedented is a word that's been knocked around at the moment, and it certainly is. But, the world of healthcare is such that no week is predictable, no day is predictable, and certainly I'm here just over a year now, and there have been a lot of things that have happened over that time. But I suppose the things you really learn is the resilience of staff, the teamwork, the ability of staff to really, all hands on deck at times of crises. And I do think the team here are remarkable in their efforts and remarkable in their commitment to patient care, particularly when there are so many challenges. And last year was a very challenging year. Financially, we'd all love to see the Dunmore wing up and running in full. Now, as it turns out, there's always some spark, because that has actually stood to us very, very well now in this particular crisis. So anyway, here we are at the end of April. Hopefully there'll be some reprieve, before the end of the summer. But we, like everybody in the community, will be waiting for that advice from the National Public Health Emergency Team.
And finally, it's lovely, Grace, to see patients that have recovered from COVID walking out the doors.
Absolutely fantastic. And one of our consultants took a little video the other day, just quite off the cuff, and there was a lady that was discharged somewhere back in County Waterford who did very, very well. But again, I think the staff, there was a lot of sentiment for staff in that lady's son, I believe, came to collect her, and he hadn't seen her for the 14 days, so it was quite an emotional thing. But it's good for staff. It's great, and it's great. We've discharged a significant number of patients, that had caused positive or COVID to date. So yeah, it's a good news story. Yeah.
A good news story. Grace Rothwell there, General Manager of University Hospital Waterford. I want to thank her very much for the interview this morning, and want to say congratulations to all the staff and patients that have been going to the hospital as well, and relatives not visiting the hospital with patients there. So it's been really, really good systems in place. So to all the staff there, particularly those that are working in ICU, well done. Congratulations from everybody here in WLR. And as you heard, Grace said, she didn't give an exact number, she said less than 15, fewer than 15 have contacted COVID, and we want to wish you the very best. And she said that they're all well, which is great news. Stay with us. We're going to hear voices from Dungarvan next.